Have y'all seen this? She's saying that her breast cancer was inherited by her father. That's so weird because what does the father have anything to do with breast cancer? Welcome to She Knows DNA. My name is Mia Vanna and I'm a board certified genetic counselor. Apparently, my baby dog Yadus wants to join me in this video, so don't mind him. So what had happened was there was an article put out by MD Anderson stating that the patient had an inherited breast cancer syndrome, but the thing is, it was not inherited by the mom. It was inherited by the dad. So I have seen a number of patients, both in my training and in my clinical practice, to where there's a family history of breast cancer on the dad's side, but the patient seems to think that they are not affected or at increased risk because it was coming from the father and not from their mother's side. So now with all this, the question stands, can you inherit a breast cancer syndrome through your dad? Y'all already know I got the answer for you, so come on in a little close so you can hear me. Yes, this is real. Before I go down the rabbit hole of this explanation, let me flex just a little bit. Yes, I am currently practicing as a maternal fetal medicine genetic counselor, essentially meaning I am working with high-risk pregnancies. However, the great thing about genetic counselors is that you are not bogged down to just one specialty. Having my degree and being board certified means that I am trained in anything genetic counseling. That includes specialties. So my knowledge is not just limited to prenatal. We're talking cancer, pediatrics, ophthalmology, neurology, cardiology, and all the extraologies in between. So now that we are all clear about the range of my genetics expertise, go ahead and take some notes and let's get into it. All cancer is genetic. That just means there's a change in DNA, which then eventually leads to the appearance of cancer. Technically, there's two changes in DNA because there's the two-hit hypothesis, but we're not going to talk about that right now. 5 to 10% of all cancers are associated with an inherited syndrome. That means there's a change in the DNA that is being passed through the family bloodline, and those persons with that change are at an increased risk of developing certain cancers. Notice I didn't say they will 100% have cancer because that's not true, but definitely at an elevated risk compared to the rest of the population. Now remember, parents go 50-50 on the DNA of their child. So it is very true that whatever history of breast cancer that's going on your father's side can definitely be passed down to you. Now, whenever we talk about cancer and genetics, all I hear is a woman saying in my ear, I have the BRCA gene. Let's clear that up. The significance is not that you have the BRCA gene, is that you have a mutation in the DNA of said BRCA gene that is causing you to be at a higher risk of developing certain cancers. We all have the BRCA gene. As a matter of fact, there's two BRCA genes, BRCA1, BRCA2. BRCA1, BRCA2. The disease-causing DNA change in at least one of the two copies of one of those genes is what leads to hereditary breast and ovarian cancer syndrome. Glad we got that cleared up. Y'all still taking notes and paying attention? Okay, I had to check. Whenever hereditary breast cancer is brought up, people automatically go to thinking about the BRCA gene. But in reality, those BRCA genes are not the only ones that can cause hereditary breast cancer. There's a number of them. These genes are not just associated with breast cancer. We're talking about cancers like ovarian, prostate, pancreas, brain, leukemia, skin cancer, thyroid cancer, the list goes on. And y'all also know that men can get breast cancer too, right? With all that being said, don't just focus on your mom's side of the family when it comes to breast cancer. And please make your doctor aware if you do have a family history of any cancer. There are guidelines specifically from NCCN that tell and identify the criteria for those that may be at a higher risk and even those that need to get tested. You may have to start your cancer screenings like mammograms and colonoscopies, for example, earlier than the rest of the population. Men, don't look away, I'm talking to you. That means you need to go to the doctor When was your last physical? When was the last time you did a blood workup? When I ask you about your current medical history and you reply with, I feel fine, that's a problem. I'm not asking how you felt. I'm trying to figure out if a doctor has diagnosed you with any type of medical condition throughout your life. Men, are we clear? Are you picking up what I'm putting down? That saying is so funny to me. In conclusion, be very transparent with your medical and cancer history, no matter which side of the family it comes from. There may not be a cure for cancer, but listen, stuff like this is what saves lives. And now to leave you with words of wisdom. Like my mama said to my brothers and I when we did absolutely nothing wrong, I've worked in public schools for almost 30 years. I know what y'all be doing. Nasty. I'll let that sit in y'all's spirit for just a moment. Well, that's all for now. If you like this video, please feel free to share, like, comment, and subscribe. And if you have any ideas of other topics that I can cover, just let me know. Also, educators, if you would like such a cool, fun, amazing genetic counselor to come talk to your class, feel free to hit me up. God bless you and see you next time. Bye.